An FDA panel recommends the COVID vaccine for children ages 5 to 11. We'll talk with the chairman of the vaccine committee. And whether it's vaccines or masks, this far into the pandemic, how do you feel about mandates? What about mandates against mandates? Today is Sunday, October 31st, 2021, and this is Flashpoint. In fact, it's the Halloween edition of Flashpoint. Happy Halloween. Hope you're having a great last weekend of October, which means we've got an election day 2 days hence. I wonder if, like me, you're sensing political fatigue among voters. A mayor's race that had no face-to-face meetings between the candidates, city council races that are coming in the midst of an ongoing corruption investigation, and 3 proposals that haven't exactly lit up the political seismographs. And, of course, it's another election held during a pandemic. And speaking of that, as parents have struggled for answers in protecting young children from the virus, the FDA's vaccine committee this week recommended vaccines for children 5 to 11. Judging from the emails on Click on Detroit, that vote inspired just as many questions as answers. And coming up, we'll again be joined by the man who heads up the vaccine committee for the Food and Drug Administration, Dr. Arnold Monto. But from vaccines to boosters to just wearing masks, as a society, we continue to debate the idea of mandates, a very thick line between recommending something and demanding it. We've even seen a Warren City councilman arrested for refusing to wear a mask inside the TCF Center recently. The issue's been particularly volatile in schools as school board meetings have fallen into free-for-alls. Well, what about a mandate against mandates? This week, Republicans in the state Senate passed several bills that would outlaw mandates for both masks and vaccines. Now, Governor Whitmer is certain to veto that, but it won't end the argument. We'll tackle that today, too, on Flashpoint. All right, let's start this morning with the man who on this program has been our guide through much of the pandemic, especially when it comes to vaccines. He's the chairman of the FDA's vaccine committee, the epidemiologist from the University of Michigan, Dr. Arnold Monto. Dr. Monto, you had quite a week, and I'd like to go back to that hearing on Tuesday. And correct me if I'm wrong, to many of us that were watching it, the mood, the vibe of that meeting felt a little different. There was a different kind of intensity. Is that because we were talking about kids, or am I maybe oversubscribing drama where you didn't necessarily feel any?
No, I think we're all more sensitive when we're talking about kids, and these are healthy kids that we're mainly talking about. And we know that healthy kids have wound up in the hospital with COVID at a lower frequency from adults, but in fact, it has happened. We've had deaths of kids from COVID, and we've also had, and there were some members who talked about this, deaths of kids from influenza. Not a whole lot, but we vaccinate kids for influenza, yep. And that's why we felt, all of us, that it was incumbent on us to provide a vaccine for those parents and their kids who want to get protected at this point, because one of the things that was very clear is that the vaccines are highly effective.
It does feel like, I think, like a different task here for a lot of parents. It's one thing for me to get a vaccine and sort of put my own life on the line if I'm making a decision for my child, which is still developing, still maturing, especially when we're talking about prepubescent children. I mean, there's a lot of different wrinkles in this when we start talking about kids. Are you convinced that we know enough? Oh, obviously, you feel that we are. But how do you convince others, perhaps, that we know enough to move forward with this?
Well, I think we do know enough. We've seen that this vaccine, the benefits clearly outweigh the risks. The risks are really very small for adults, especially adults over about 30 to 40 years of age. The one thing that we have seen, which is clearly associated with the vaccine, is in typically mainly adolescent males, an occurrence of myocarditis. It's very low frequency, but it is related to the vaccine. And that's why, among other reasons, the amount of stuff, antigen, that's in the vaccine is reduced by a third. We've got only about a third of the mRNA in the vaccine. In kids, this works. It produces good responses. And the sponsor was able to provide us with data which showed us more than 90% effective in preventing symptomatic COVID. Not hospitalizations, and from the other data, we'd expect that it would be even higher.
Right. But when you hear a parent say, look, we know that there are some of these cases of myocarditis and we don't know why they're happening, it's irresponsible to move ahead until we have that figured out. What would you say?
I think we need to continue because we've looked at this. We had a very detailed analysis of risks, benefits, putting into the equation in terms of the risk of myocarditis. And that convinced us that we should be moving ahead. We do know that people do have questions, and that's why the committee in general felt that we're not yet ready, if at all, ever, for mandates for children. But many parents want to get their children protected. They know that they are at risk, and they know that attendance at school is very important, and we've seen school outbreaks.
Yep. Yep. Especially, it's hard to miss the fact that a lot of them are in places where there hasn't been any sort of masking protocols as well. I'm curious about letting you clear up something that we talked about on one of our newscasts this past week. Parents of 11-year-olds feel like they're in this sort of strange intersection right between our vaccine protocols. And we've had some questions come into the newsroom. Our Dr. Frank McGeorge tackled this week. I want to let you handle the same question. Why are we talking about age instead of weight, as we do with a lot of medications?
Well, because this is not a medication. This is a vaccine, and the question, they're typically, for example, with influenza vaccine, there used to be a smaller amount of vaccine given to very young children under 5 years, or it varied in different countries. And we've gone in general to a single dose. The reason we are reducing the dose here is that we know that there is good response to a third of the dose. And there was another question, well, why an 11-year-old are you giving a third of the dose and a 12-year-old the full dose? And my answer to that is we need to see whether we can give a third of the dose to the older children, because it probably would work. We really haven't evaluated going down as far as we can with the dose, because we've only had a year to work with this. And the hope is to stop outbreaks.
I think part of what you're suggesting there, that we're still learning a lot, is what is also the FDA, your marching orders are to figure out whether this vaccine is safe. It's not really to weigh in on mandates. That's left to others, but that doesn't mean you don't discuss them. And you all discussed mandates the other day, and you're not really comfortable with the idea of this vaccine being mandated for children yet, right?
That's right, because we really need more information about these total effects. We don't know. We think that we're going to be able to reduce transmission to other family members or teachers and the rest. We'd like to see observations to prove this. We can extrapolate from what we've seen with other respiratory infections, but this virus is different in many ways. So we go with the best information we have at the time, and then fine-tune as we go along. But we feel comfortable, and a lot of my medical colleagues are eager to get their children vaccinated. There are some that don't want to, so we need to not be telling people what to do now, but advising.
We've got obviously still a lot more to learn, not only about the vaccine, but still about COVID this much time after it first arrived. Dr. Monto, it is always good to have you on the program. You're a terrific guide through the decision making that you've been doing at the FDA. Thanks so much. We'll talk to you again soon, I hope.
My pleasure.
You bet.
Bye.
Dr. Arnold Monto, epidemiologist from the University of Michigan. We'll continue with more on Flashpoint right after this.
you've got enough to think about maintaining. Good thing the all-new 2022 Volkswagen Taos has a lower cost of maintenance than Honda CR-V. Come into your Volkswagen dealer today and lease the all-new 2022 Taos S4 Motion for just $229 a month.
HAP has been part of the Michigan community since 1960, and we're here with Medicare Advantage plans designed just for you. With benefits like dental, hearing aids, over-the-counter allowance, transportation, travel coverage, and telehealth. Call 888-889-2655 to learn more and get your free Medicare benefits guide. Hurry, Medicare enrollment ends December 7th. HAP Medicare Advantage. Made in Michigan, for Michigan.
So you have diabetes. Here are some easy rules. No sugar, no pizza, no food you love. Stress? No stress. Exercise, but no days off. Easy, no? No. With Freestyle Libre 2, you can take the mystery out of your diabetes. Now you know.
Sir, you know what you want to order?
Yes. Freestyle Libre 2. Try it for free.
It's nice to know your blind spot can be protected. Blind Spot Monitor, standard on all 2021 Volkswagen SUVs, unlike all Honda or Subaru SUVs. Come into your Volkswagen dealer today and lease the sophisticated and capable 2021 Tiguan S4 Motion for just $279 a month.
Hank, what's going on with all these shortages? I've been shopping and there's nothing on the shelves.
I mean, can you believe it? We're talking about electronics, toys, even groceries.
Yeah, that's right. So what am I supposed to do?
Well, one piece of advice, shop right now. In fact, what we're going to do is we're going to help all of you who are searching for solutions. We have special reports all next week, and my coverage is going to begin Monday morning at 6:30 a.m.
Don't let the fall weather make you feel powerless. Count on the local forecasters to keep you informed.
All right, welcome back. So let's talk more now about mandates. State Senate Republicans passed several bills last week aimed at curbing the ability of local jurisdictions to put mandates in place for vaccines or masks. Now, that won't get past the governor's veto pen, but this debate is playing out all over the state, sometimes in very ugly shouting matches that have been happening at places like school board meetings. Let's talk about it all. And joining me now, Chastity Pratt, the Education Bureau Chief for the Wall Street Journal. Ingrid Jacques is the Deputy Editorial Page Editor at the Detroit News. Nancy Kaffer on the lower right-hand portion of your screen, columnist for the Detroit Free Press. And at the upper left of your screen is Kara Beer, the President of the Battle Creek Area Chamber of Commerce. Thank you all so much for being here. Chastity, I want to start with you because, and we'll start with masks before we get to vaccines. I thought we had a pretty good handle on what was happening after Macomb County famously decided there would be no mask mandate in place, and then Macomb County led the state in cases, outbreaks in schools. I thought the math was pretty simple. Well, fast forward to last week, Oakland County, which does have a mask mandate, suddenly leads the state in cases. Do you think we have a handle yet on what works and what doesn't for schools?
What we're seeing in Michigan is no different than what we're seeing across the country. It's a box of chocolates. You never know what you're going to see from this district from week to week. The data comes in, at different times, in different places. So the numbers are going to be up and going to be down. And, we're going to be living with COVID for a while. And to expect that there's going to be some sort of, agreement as far as how the data goes, and as far as how the people's feelings about the mandates go, I think it's just folly for us to think that there's going to be one understanding of this that's going to continue throughout the months and years to come. I think the one thing, Devin, whether there's a mandate or not a mandate, whether the numbers are going up and going down as far as schools are concerned, the big question is, what is going to increase and improve teaching and learning? So, we can chase the number if we want to.
A really critical part of this that we're still learning on the fly. Ingrid, I've gathered from a lot of your writing on this that's your take, is that we can't really, one size does not fit all.
Yeah, absolutely, Devin. I think in these cases, we need to give as much flexibility to the local districts, local health departments as possible. I think top-down mandates, whether from the state, the federal government, these are just, they cause more controversy. And I think in the end, they're not helpful. These are decisions that, as you mentioned, there's been a lot of very heated school board meetings, a lot of parents frustrated with how their schools are handling things, but that's where these decisions should be taking place. And, there are no easy answers, but I think the parents, teachers, people in each community are really going to have to work this out for themselves. And this is going to just get that much more heated once the vaccines for younger kids come on the scene too.
It's interesting, though, Nancy, because I don't think a lot of the people who want to talk about personal choice in all of this, I can't see them making the argument that that a student who had hepatitis should be allowed to come to school. And I think that in some ways, isn't that what we're talking about? When it comes to the virus, we're talking about secondhand smoke more than we're talking about personal choice, aren't we?
Well, yes, for sure. And I think it's worth noting, to Ingrid's point, that we don't have a top-down mask mandate. These are all the mandates that we do have are at the county level or at the school building level. We don't have a federal or state mandate for masks. And yeah, I mean, any of us who have kids know that we got our children inoculated for a large number of things between birth and 5. We got chicken pox, which prior to the vaccine killed 100 people a year, measles, pertussis, childhood illnesses that are quite dangerous to pretty unpleasant. But yeah, it's an excellent analogy that you made. We have some pretty practical tools, masks, and soon hopefully vaccines for small children that are very, going to be effective at containing this. And it's so surprising that there's so much resistance, especially in the absence of a top-down mandate and instead rules that are being made in local communities.
Before I get to Kara, Ingrid, you want to take a whack at that? Because we do have vaccine mandates in place for measles, mumps, rubella, and they very seldom get the kind of pushback that we're seeing over this.
Right, but those have been around a long time, and we know that they work and they're safe. I think a lot of the pushback to these COVID vaccines is that they are so new, and especially with young children, there hasn't been as much testing, as much research. So I think it's just going to take time for some parents to become comfortable. I mean, I've heard a lot of feedback from parents who they get their kids inoculated for all these other things. They're just not sure yet about this. And I think that is a piece of this, just the newness of it. And hopefully it will become routine, just like all the other shots, so that we can really put COVID behind us and, focus on what kids are learning in the classroom again, which has not, we really need to get back to that.
The chickenpox vaccine, by the way, was introduced in 1995. I don't remember a huge outcry over that. That's probably the newest vaccine I can think of. I guess the HPV vaccine is newer than that. But I'm 46, people my age weren't inoculated for chickenpox. My child was inoculated for chickenpox, which again killed 100 people a year in this country before the vaccine, which is not really a comparison to COVID. But again, I don't remember a huge controversy when that came out. But maybe I'm not old enough to remember that. So.
Let me broaden this out to the business world. Kara, there are a lot of business owners that feel like this onus now that has been put on them to kind of have to act as police in their stores, among their employees, so it's either customers or workers, has been asking too much of business owners to sort of police all of this.
Absolutely, because we haven't even seen the draft yet of what this actually looks like. So in other words, really trying to find out where does it stop? If we have a mandate in regards to this, our employers also going to have to mandate for other things coming down the pipeline. Is it that we have to mandate for the flu? Do we have to mandate for all, like the students going to school from birth to 5? Looking at it from that standpoint, but also who in the business is going to be the one that is getting access to rapid tests? We don't have enough rapid tests in the state of Michigan. We don't have access to who's going to perform those. Is that going to be a duty upon somebody in our offices or in our businesses that has to do the rapid test for their employees once a week, as well as the expense? What's it going to do to the insurance of those companies? There's just a lot of different things that we have to think about, and our businesses are really struggling right now with the talent shortage. And so this is another thing is playing a role in that. When we look at the state average of how many people are vaccinated, if you take out those that are 65 and older, and the youth out of it, what is that number? That there's still a significant population of folks that aren't vaccinated. And so businesses are having to really play a major role in trying to do that. And it's putting a lot of burden on them when they're trying to run their business.
Well, in fact, we had a business owner on this program a couple of weeks ago, Liz Blondie, who said that if she was forced, if she enforced a vaccine mandate, she would lose just enough employees to probably drive herself out of business. But Kara, how do you feel though about a mandate against mandates, which is what we saw this past week in Lansing? We've watched this play out in a number of other states, famously. It seems like famous last words of a fool to say we're never going to allow somebody to put a mandate in place, isn't it?
I think that's definitely a great point. I think that you have people that, to have no mandates is definitely a little bit of an overstep, but really looking at what is it that we're wanting to mandate? Is the reason why we're putting this in place because we don't want to see a mandate on this vaccine or the healthcare of folks? Really, I think we have to get to the root cause of what that is and why we are looking for that, because I think we have to realize that businesses need the ability to, just as we were hearing earlier, with school districts being able to make those decisions in their boardrooms as well as in their township halls and different things like that. Businesses need that opportunity to be able to say, this is good for my business to be able to be successful, and my employees. Yeah. And I think that that's really important.
Yeah. Chastity, it won't be long, though, before we start to hear some people arguing for a vaccine mandate in schools. What do you expect? How do you expect that to go?
If history serves us, it'll go along political lines. California is already the first state to say as soon as it's available, we're going to get vaccinated starting in the 2022 school year. So that's not far behind. It'll go, along the same lines as we saw with the masking and the testing. The thing of it is, though, we talk about what the communities need. The communities are trying to protect. Communities and cities are trying to protect everyone in their businesses. The businesses are concerned with their labor force. But again, going back to schools, they're concerned with the setting that is going to allow for students to have uninterrupted in-person learning so that so we can get back to learning. Going into the pandemic, Michigan was lacking, very much so, bottom 10 achievement. And now we saw this summer that the test scores are even worse. Every test score is down except for reading amongst the older students. Right. So the question, when we talk about vaccines, how does that connect for schools having uninterrupted in-person learning? What we're also going to see, Devin, is the conversation around, well, should schools become vaccination sites? In addition to students being required to have vaccinations. That's the next debate.
Ingrid, you haven't loved, as you said earlier, you haven't loved the idea of mandates, but how do you feel about the mandate? Should we be setting up laws against mandates?
I think it's bad either way. I think these efforts that we're seeing in, like you mentioned, in the Michigan Senate, we've seen in Texas and Florida. Clearly these are, in Texas and Florida's case, these are Republican governors trying to stand up to the Biden administration. But what businesses are making pretty clear, I think local school districts, they just want to be able to make these decisions for themselves, what works best for their business, their school district. Having top-down mandates, either whether it's for the vaccine or against mandates, I don't see that as being helpful.
Nancy, I've only got about 20 seconds left. As I said to Dr. Monto, it's one thing for adults to make a decision about whether we're going to get a vaccine. It's another to make a decision about someone else for kids. Where are you on that right now, on that decision for your family?
My child has been begging to get the vaccine for a year now. He's 11, and he keeps saying, "Can't you just say I'm 12?" He really wants to go back to normal life. He's already had one school quarantine this year, and if he's vaccinated, presumably he won't have to quarantine after an exposure. So,
friends, I got to get to a break. It's a terrific conversation. Thank you all so much for being a part of it. Hopefully we'll see you in person real soon.